staying in Maruga. This lady real lucky. She bunks up with sweet me. As a man with a plan, well, I really didn't waste no time. I'll make up my mind.
All right, everybody. Yes, and that's what we're speaking about now. Changing women's health care in the Caribbean. And we're now joined by Dr. Rachel Corridon, obstetrician and gynecologist and the founder of Harmony Health, Women's Health and Home Birth Services. Doctor, good morning and thank you very much for coming this morning. We do appreciate it.
Good morning and thank you for having me.
So, Doctor, changing women's health care in the Caribbean, that sounds like a lofty objective there, a weighty objective, you know. Doctor, let's speak a little more about it.
It sounds like a weighty objective, but it starts basically with the individual patient and our interactions. Yeah. So my way of dealing with my patients is, as the name suggests, a gentle way, compassion, empathy, allowing women to have a voice, and also educating women so that when we come to them with a healthcare management plan, we are giving them all of the facts. We are giving it to them in a way that they can understand, that they can dissect. And in that way, they are able to make decisions. Decisions not based on coercion, but decisions for their best health based on the information that we give to them.
Yeah.
And they don't feel like someone is, holding their hand and dragging them in a particular direction.
Yeah. It sounds traumatic, doctor. And I suspect that's where you and your team and your organization, that's where you all come in.
Yes, that's where we do come in. And this didn't just start with me. It started with the influence of my mother.
Yes.
So when we say team, it's really a midwife and an obstetrician. So my mother is a midwife, and she would have been the example that I would have had from a young girl, looking at her and the way she would interact with her patients from the bedside to their labor process, even the way that she would interact with doctors. And one thing she would tell me when I started, the nurse is your best friend. Respect the nurse and you will get very far.
I think a lot more nurses need to listen. Yeah? Go ahead,
so
doctor.
in that way, I developed a unique perspective in the way that I deal with patients. As we know, the nurse is the patient advocate. So I kind of marry that tone with the way that I deal with my patients, as opposed to the paternalistic tone that traditionally medicine may have had.
Yeah. And I think with that, an environment of empathy and caring and even sympathy,
yes,
I think that the patient is better able to communicate better with the health practitioner, and doesn't shut down mentally, and it doesn't add to the trauma that the individual is going through. And I think that's very, very important, because I think that at that stage of the game, the patient, the woman, she's already in this sort of, I don't want to say unstable, but this vulnerable state.
Vulnerable.
Right? And you want to create an environment where she feels comfortable and safe.
So we kind of probably not eliminate,
yes,
but reduce fear, and also we reduce anxiety in the whole process of managing our health.
Yeah. So, doctor, we are also commemorating Breast Cancer Awareness Month. Yeah. What is your message?
Well, the theme for this year is every story matters and every journey matters. And basically, that's where I would like to jump off, because that is just like my theme, the way that I deal with my patients. Your body, your baby, your way. So your story matters, your journey matters. And in that vein, we recently developed a 5-part series in the open about breast cancer stories. And so we took these stories from the survivor, the family member, the surgeon, the oncology-related doctor, even the mammographer. And so all of these stories come together to educate and to allow women to know that, hey, you have a voice, your story matters, and we want you to take these stories into your account and go get your screening, because early detection saves lives.
Yeah. Speak about early detection and speak about screening, because I think that there is still a bit of taboo about that. You know, doctor, I don't know if you know, but we still do have people in Trinidad and Tobago who believe that if they don't know, that is a benefit for them.
What I don't know won't harm me.
Right.
Yes. Well, the thing about it is, if we detect breast cancer, if we detect it early, in the early stages, you have a 99% chance of survival in the first 5 years, as opposed to if it is spread to the lymph nodes, for instance, that survival could fall to about 30%. So the fact is, what we know can save us. And so it starts with you knowing your body. Your simple self-breast examination at home. You come out of the shower at the end of your menses when your breasts are not so tender. You take a look at them, make sure they look the same way they did last month, you know, no changes on the skin or on the nipples. You have a feel around all of your breast tissue under the arm, even by your clavicle, and these areas are where, if there is drainage or spread, you may feel lumps in the nodes. And then you also want to give a little squeeze on the nipple. You're looking for abnormal discharge. And so this is your self-breast examination. And for women over 40, you want to start doing your screening. Now, we could have conversations with women who are at higher risk to do the screening earlier, but generally between the age of 40 to 45, you want to start doing your screenings, which would include breast ultrasounds and mammograms. And we are doing those beyond the age of 60, and you can start to space it out after 55, but we want to do it yearly from 40 to 55 or so.
Let's talk a little bit about this higher risk group.
So the higher risk group, these are, now just to be clear, most breast cancer cases are sporadic, so not necessarily based on a genetic predisposition. But if you do have a genetic predisposition, let's say your family member had breast cancer, or there are other forms of cancer such as ovarian or colon cancer in your family, and they did detect the gene BRCA1 and 2, then you are definitely at a higher risk of developing breast cancer. And so you may choose to look for the gene in your own body by doing genetic testing, and based on that information, you may have to make some serious decisions thereafter, which your doctor will go through with you.
You know, doctor, when we do think about someone who has cancer, I think we do as a society think about that person individually, and I think that person also believes that they are also alone in this fight. But, and you did allude to it, you did speak about relatives earlier and the impact that cancer has on that individual, but the entire family and other persons. Speak to that a little bit for us, and talk about the importance about support, of support. Because
basically no man is an island, right? And women and men can get breast cancer, but let's say it's the mother. When the woman gets breast cancer, the family gets breast cancer, basically. The husband is watching his wife probably deteriorate, go through the emotional roller coaster of getting the diagnosis, going through all the testing. The children are confused. They don't understand what is happening. Am I going to lose my mother? There's a financial impact on the family as well. You may have to do certain tests that may not, in our system, may not be available as readily publicly. So you may have to dig a little deep in the pockets to get certain things done. Also, there's a time factor. Life changes. So you would have been working, probably you would have been dropping the kids off to football, swimming, everything changes. And your family unit, if it's a closed-door family unit, may now have to be open to other relatives who may have to give additional support the family and keeping the kids going and keep trying to maintain some form of normalcy. So it's not just the patient, it's everyone. It's the transportation between sessions of radiotherapy or chemotherapy. It's a lot that goes into this one person that has the diagnosis of cancer.
Yeah. What's the main message that you would want women to take away from this Breast Cancer Awareness Month?
I would want women to take away this: early detection will save your life. Don't be afraid of the unknown, but I tell my patients that knowledge is power, and what we know we can work on. No matter what the information is, we can work on it. And of course, with faith, we will go through it, and we will hold your hands as the practitioners and take you through that diagnosis.
Yeah. I want to touch on an issue that you alluded to, and I think that many people may not have heard what you would have said. But while we were having the conversation this morning, I knew a gentleman. He's no longer here with us. But he too was diagnosed with breast cancer.
Yes.
And before him, I never even thought that a man can get breast cancer. Speak to that for us.
So although breast cancer is the most common cancer in women and the most common cause of cancer death in women, we have to know that men do have breasts, and they do have a predisposition as well to have breast cancer, but it's just not as common as women. So we're not saying that men need to get mammograms or breast ultrasounds or anything like that. But if you do notice anything different on your chest area, any nipples, don't hesitate, because as you know, men are probably a little worse than women in terms of getting health attention. Right. If you do notice a difference, then by all means go get it checked.
Yeah. Men, you hear what the doctor said to us this morning, a very profound statement. Men have breasts too. Remember that. Doctor, let's talk a little bit again about how your organization plays into all of this, providing services and empathy, etc., etc., etc.
Well, as we discussed before, Your Gentle Gynecologist, that came from my patients.
Yes.
It's something that they would have said to me in terms of my interactions with them. They would say, you finished? I didn't feel that.
You have gentle hands?
Yes. You finished with that, Pap Smear? And so that was a jump off point for that name. And Harmony, it was just something that was in my heart. Yeah, so I marry that sense of peace, and also peace in terms of, as I said, giving women education.
Yes.
So when I am online, whatever I'm doing in the consultation room, it's all about educating. Even my consultation time is a little bit longer. Some may have 30 minutes. I could go up to 40, sometimes 45. Just talking to my patients, making sure that they understand what I'm saying, what I am explaining to them, what is going on with their health. And so that empathy, as you mentioned, sympathy, education, married with international best standard.
Yeah.
We take care of our patients in that manner.
How do patients get in contact with you?
You can find me, Your Gentle Gynecologist, on Facebook, Instagram, TikTok, and you can find my links there, and you can get in contact with me that way.
So is it that the services that you provide, it's at the screening stage, if I can put it that way, right? The detection stage, the screening stage, tests,
correct.
right?
Yes.
So if someone is diagnosed with cancer, the after treatment too?
They have to be referred.
Yes.
So I'm a gynecologist.
Right.
I am not a breast specialist or a gynae oncologist.
Right.
So for the gynecologist, our role is in detection.
Yes.
Right? So once we detect an issue, then we would refer the patient on to the subspecialist.
Yeah.
Yeah.
All right. Doctor, anything else you'd like to touch on that we haven't touched on? I have about a minute again.
Sure. I would just like to say that for women, I want you to enjoy your life. I want you to understand that your well woman check is important. You don't have to wait for an issue to come up to come see the doctor.
Yeah.
That includes just getting your blood pressure checked, your diabetes screening. It's a holistic health that we do even as gynecologists. So you don't have to wait for a problem. Do go in and get your normal well woman health checks and check on yourself at home. Do your breast exams as we are commemorating Breast Awareness Month, and be happy with your life.
Yeah. Dr. Corridon, thank you very much for coming this morning. She's a GG too, you know, a gentle gynecologist. Yeah? We're going to have a break, everybody. We're coming back.